Are you living with hepatitis C and wondering which treatment is right for you? In this video, we will compare two popular antiviral medications, Harvoni and Epclusa, to help you make an informed decision on your path to healing. Understanding hepatitis C. Hepatitis C is a viral infection that primarily affects the liver. It is transmitted through contact with infected blood, most commonly through sharing needles, receiving contaminated blood transfusions, or engaging in unprotected sexual activity with an infected person. Chronic hepatitis C can lead to serious liver damage, including cirrhosis, liver cancer, and liver failure if left untreated. Efficacy and safety of Harvoni. Harvoni, approved by the U.S. Food and Drug Administration (FDA) in 2014, has been one of the go-to treatments for hepatitis C. It is a combination drug containing two active ingredients, lead-pesvir and sofosbuvir. These direct-acting antiviral agents work together to target the virus at different stages of its life cycle, inhibiting its replication and preventing further damage to the liver. Clinical trials have shown that Harvoni is highly effective in curing hepatitis C in a majority of patients, with cure rates ranging from 94% to 99%. This makes it one of the most successful treatment options available. Moreover, Harvoni is generally well tolerated, with minimal side effects reported. The most common side effects include fatigue, headache, and nausea, which are usually mild and transient. Efficacy and safety of Epclusa. Epclusa, approved by the FDA in 2016, is another widely used antiviral medication for hepatitis C. Unlike Harvoni, which is specific to certain genotypes of the virus, Epclusa has a broader coverage and can treat all 6 major genotypes of hepatitis C. This makes it a more versatile option for patients with different genotypes of the virus, eliminating the need for genotype testing. Similar to Harvoni, Epclusa has shown remarkable efficacy in curing hepatitis C, with cure rates exceeding 95% in clinical trials. Its active ingredients, sofosbuvir and velpatasvir, work together to suppress the replication of the virus and halt its progression. Epclusa is generally safe and well tolerated, with side effects similar to those of Harvoni, including fatigue, headache, and nausea. Key differences between Harvoni and Epclusa. While Harvoni and Epclusa are both effective treatments for hepatitis C, there are some key differences between the two that may influence your treatment choice. One significant difference is the coverage of different genotypes. Harvoni is approved for the treatment of specific genotypes, namely genotype 1, 4, 5, and 6. On the other hand, Epclusa can treat all 6 major genotypes, making it a more inclusive option for patients with different genotypes of the virus. Another important consideration is the need for genotype testing. Harvoni requires genotype testing to determine the specific genotype of the hepatitis C virus before treatment initiation. This ensures that the medication is targeted to the specific genotype, maximizing its efficacy. In contrast, Epclusa does not require genotype testing due to its broad spectrum coverage, simplifying the treatment process for patients and healthcare providers. Choosing between Harvoni and Epclusa. Choosing the right treatment for hepatitis C depends on various factors, including the genotype of the virus, previous treatment history, liver function, and potential drug interactions. It is crucial to consult with a qualified healthcare professional who can assess your specific needs and recommend the most appropriate treatment option. For patients with genotypes covered by Harvoni and no contraindications, Harvoni remains a highly effective and well-established treatment choice. Its proven track record and high cure rates make it a reliable option for those seeking a targeted and genotype-specific treatment approach. On the other hand, if you have a genotype that falls outside the coverage of Harvoni or prefer a treatment option that does not require genotype testing, Epclusa may be the more suitable choice. Its broader coverage and simplified treatment process make it an attractive option for patients with diverse genotypes or those looking for a more straightforward treatment experience. Your healthcare provider will consider your individual circumstances and preferences to guide you toward the most appropriate treatment option. They will also assess any potential drug-drug interactions, your liver function, and any coexisting medical conditions to ensure the chosen treatment is safe and effective for you. Cost comparison of Harvoni and Epclusa. The cost of hepatitis C treatment can be a significant consideration for many patients. Both Harvoni and Epclusa are expensive medications, but their prices may vary depending on factors such as insurance coverage and healthcare systems in different countries. In the United States, the average wholesale price of Harvoni for a 12-week treatment course is around $94,500, while Epclusa's average wholesale price is approximately $75,000 for the same duration. These prices may be subject to negotiations between insurance providers and pharmaceutical companies, resulting in lower costs for patients. It is important to note that the cost of treatment should not be the sole determining factor in choosing between Harvoni and Epclusa. The efficacy, coverage, and potential side effects should also be taken into account, as they play a crucial role in achieving a successful outcome. Side effects and considerations. While both Harvoni and Epclusa are generally well tolerated, it is essential to be aware of potential side effects and considerations associated with these medications. The most common side effects reported with Harvoni and Epclusa include fatigue, headache, and nausea. These side effects are usually mild and transient, resolving on their own without any specific intervention. However, if you experience severe or persistent side effects, it is important to inform your healthcare provider promptly. It is worth noting that Harvoni and Epclusa may interact with certain medications, including some over-the-counter drugs and herbal supplements. Before starting treatment, make sure to inform your healthcare provider about all the medications and supplements you are taking to avoid any potential drug interactions that could affect the effectiveness of the treatment or increase the risk of side effects. Patient testimonials and experiences. To gain a more comprehensive understanding of the real-life experiences with Harvoni and Epclusa, it can be helpful to explore patient testimonials and experiences. Many individuals who have undergone treatment with these medications have shared their stories online, providing insights into the effectiveness, side effects, and overall treatment experience. Reading patient testimonials can offer valuable perspectives, but it is important to remember that each person's journey with hepatitis C and their response to treatment is unique. What works for one individual may not work for another. Therefore, it is essential to rely on the guidance of qualified healthcare professionals who can tailor the treatment plan to your specific needs. Conclusion: making the right treatment choice. When it comes to choosing between Harvoni and Epclusa for the treatment of hepatitis C, there is no one-size-fits-all answer. Both medications have proven efficacy, with high cure rates and generally manageable side effects. Harvoni, with its established track record and genotype-specific approach, remains a reliable choice for patients with specific genotypes covered by the medication. On the other hand, Epclusa offers a broader coverage, eliminating the need for genotype testing and simplifying the treatment process for patients with diverse genotypes. Ultimately, the decision should be made in consultation with a qualified healthcare professional who can assess your individual circumstances, consider any potential drug interactions, and guide you toward the most appropriate treatment option. Regardless of the choice you make, both Harvoni and Epclusa have the potential to lead you on a path to healing from hepatitis C.